Okay, let's jump right in. Today, we're talking about something really important: how to be proactive in managing your diabetes to protect your eyes, your nerves, and your feet for the long haul. It's all about taking charge of the little things now to avoid much bigger problems down the road. So here's the big question we're tackling. How can the choices you're making today, right now, actually build a healthier you for years, even decades into the future? Well, it turns out your body has this amazing ability to remember the good things you do for it.
And that brings us to this incredible concept called metabolic memory. Now, think about it like a health savings account. Every period where you have good, steady glucose control, you're making a deposit. And those deposits? They keep earning interest, protecting your body's tiny blood vessels for years and years, even if things get a little tougher to manage later on. It's a really powerful idea that what you do now pays huge dividends later.
So, how are we going to break this down? Here's our game plan. First, we'll dive into protecting your vision. Then we'll get into understanding your nerves. From there, we'll build on that with a solid foundation of foot care. And finally, we'll tie it all together into your personal proactive care plan. All right, first up, your vision. Look, diabetic retinopathy is the #1 cause of new blindness in working-age adults. That sounds scary, I know, but here's the good news. With the right strategy, there is so much you can do about it. So how does this actually happen? Well, in the very early stage, these tiny little bulges can pop up in the blood vessels in the back of your eye. As things progress, those vessels can start to leak, which messes with blood flow. Then, in the advanced stage, your body, trying to help, grows new blood vessels. But the problem is, these new vessels are weak and fragile, and they can lead to swelling and some serious vision problems. And here's the absolute key. You can be in those early stages and have zero symptoms. None at all. And that is exactly why screening is so critical. If you have type 1 diabetes, you should get your first big eye exam about 5 years after you're diagnosed. But for type 2, the recommendation is to get it done immediately, right at diagnosis. So why the difference? Well, with type 2 diabetes, it can often go undiagnosed for years, which means changes in your eyes could have started long before you even knew you had it. And it's not a one-and-done thing. These follow-up exams are absolutely essential. If your eyes get a clean bill of health, then checking in every 1 to 2 years is usually the plan. But if they find any signs of retinopathy, even the earliest stages, you'll need to be checked at least once a year to stay way ahead of any problems. So what happens if things do progress? Well, the treatments today are pretty incredible. Laser therapy, for instance, can actually seal off those leaky, problem-causing blood vessels. Another really powerful tool is something called anti-VEGF injections. See, your body has this signal called VEGF that tells it to grow new blood vessels. These injections basically block that signal, stopping those fragile new vessels before they can even form. The main trade-off? You might need to go in for injections more often than you would for laser therapy. So let's put it all together. Here's your vision action plan. It really boils down to managing your ABCs. That's your A1C, your blood pressure, and your cholesterol. And just as important, get those regular dilated eye exams and never, ever hesitate to talk to your doctor about any little change you notice in your vision. Okay, let's shift gears and see how this all connects. We're moving on to understanding your nerves. Diabetic neuropathy is an extremely common complication, but honestly, it's often misunderstood. And this number right here, this is why it's so tricky. Just like with your eyes, up to half, 50% of all peripheral neuropathy cases have no symptoms. You could be feeling totally fine, while underneath the surface, nerve damage is quietly progressing. This is why proactive screening is not just a good idea, it's absolutely essential. Now, when symptoms do show up, they can feel very different depending on which nerves are involved. Damage to the small fibers often causes those sensations we hear about a lot: pain, burning, or tingling. But large fiber damage is a different animal. That can lead to numbness, trouble with your balance, and the loss of what we call protective sensation. Think of that as your body's built-in alarm system, the one that tells you a surface is too hot or a shoe is rubbing a blister. For anyone who does experience nerve pain, the good news is there are some really effective treatments that can make a huge difference in your quality of life. The guidelines point to several types of medication as the first line of defense. And I want to be really clear about this next part. Opioids are not recommended. The long-term risks are just too significant, and frankly, they don't fix the underlying nerve problem. So here it is, your nerve health action plan. Simple, right? Get screened for neuropathy every single year. Work on optimizing your overall health because glucose, blood pressure, lipids, and weight all matter. And please, speak up. Talk to your doctor about any new symptoms, even if they seem small, like a little numbness, dizziness, or even digestive troubles. This leads us perfectly into our third section, foot care. Because what happens when you lose that protective sensation we just talked about? Well, you create the perfect storm for really serious problems with your feet. This quote from one of the studies we looked at just says it all. In a study of people who had foot ulcers, more than 63% had this exact combination of three things: nerve damage, a small injury they probably didn't even feel, and some kind of issue with the shape of their foot. You can see how those three things together are a clear recipe for a major problem. So doctors use a system like this one to figure out your personal risk level and how often you need a professional to check your feet. You see, if you have no loss of sensation, a checkup once a year is fine. But as soon as you add risk factors like neuropathy or poor circulation, those checkups need to happen way more often, sometimes as frequently as every 1 to 3 months if you're in that high-risk category. So what should that exam actually look like? It's a pretty straightforward 4-part check. Your doctor should inspect your skin really well, look for any changes in the shape of your feet, test for nerve damage with a simple little tool called a monofilament, and finally, check the blood flow by feeling the pulses in your feet. But you know what? The single most important foot exam is the one you do yourself every single day. This simple checklist right here, this is your superpower. It can prevent the vast majority of problems. Just check your feet, keep them clean and dry, never ever go barefoot, and make sure your shoes fit well. It's your best line of defense, hands down. Okay, it's time to bring it all home. Let's pull all these threads together and build one single powerful strategy for your long-term health. If you remember one thing from our time together today, let it be this: your eyes, your nerves, and your feet are not separate issues. They're all connected by the health of your tiny blood vessels. A strategy that protects one of them helps protect all of them. It's all connected. And the best part is, you don't have to do any of this alone. Managing diabetes is a team sport. Building your team is vital. You've got your primary care provider, your eye specialist, and your foot specialist. They should all be working together with you at the center to coordinate your care and catch any issues super early. Let's leave it with this powerful thought from the research. Now, it's talking specifically about feet here, but the principle is true for everything we've discussed. Early recognition and quick action, that is the key that can delay or even prevent the worst outcomes. It's all about being proactive. Which really just leaves us with one final question for you to think about. Is your care team helping you build your proactive long-term health plan?